Hello everyone. This is a very short audio clip related to the subfertility module, and today I'll be discussing about the management of bilateral tubal blockage in a simulated patient task. This is a very important exam scenario, and again I have tried to keep it as simple as possible. So in this, when you will be explaining the result to the patient, there has to be mild signposting. So you will tell her that, Mary, I have confirmed the name, age, and NHS number on the result. Do you have any idea about your result? Well, I have some concerns regarding the result. As per the result, it seems your tubes are blocked. And do you know about the test, how it's done and why it's done? Would you like me to tell the details? If she says yes, then you will explain about the test, the hysterosalpingogram in details. If she says no and she wants to know about the causes, then follow the patient's, the role plays agenda. And then you're not going to discuss anything about the hysterosalpingogram. You're just going to discuss about the causes, that why the tubes can be blocked, right? So if she wants you to tell in details about the procedure, then you can draw, or if hysterosalpingogram image is given, then explain on the image and explain to her. So Mary, you can see with me in this drawing or in the image given here that this is the womb, this is the neck of womb, these are the tubes, and these are the ovaries. So, and the tube, it connects the womb to the ovary, right? And in this test, which is the dye and X-ray test, the dye is instilled from down below, from your neck of the womb, and then we follow the dye with X-ray and take multiple pictures. The dye fills the womb, the tubes, and if tubes are open, the dye spills out. It means that the tubes are normal. There is no blockage. But if tubes are closed or blocked, then there is no spillage of the dye. It means that there is some blockage, and this is not normal. And in your case, dye could not be spilled out, suggesting tubes are closed or blocked. Am I clear so far, Mary? So there can be several causes. One is that if the tube goes into spasm due to pain, or there is some problem in the tube, or some scar tissue is there inside the tube due to previous surgery or because of infection, and the scar expanded when dye was injected and it caused pain. Am I making sense, Mary? Do you have any questions so far? So would you like me to tell in details about the management options? So to confirm whether your tubes went into spasm due to pain or there is some problem, we need to arrange further tests. One is that we can offer you repeat test with painkillers and give you medications to relax your tube. Now here the role player is going to say no. She will say, no, it was so painful for me, I'm not going to have this test again. Then tell her about the other options, that we have another test, that is the high CoC, in which the fluid or the dye is instilled from down below. Scan is done to check the flow of fluid and tubes. And we can also offer you the keyhole surgery and then explain about the procedure, how it is done, and about the risk and complications, right? So you will tell her that in this small telescope and camera will be inserted through your belly button. The dye will be instilled from down below, from the neck of the womb, and we will see with the camera if dye spills out or not. So it's a major surgery. Generally, it's a safe procedure which will be done by the expert keyhole surgeon after putting you to sleep. But there is risk of surgery and anesthesia, like damage to bowel, bladder, blood vessel, or there is some risk of pain and infection as well. And if the dye is spilled out, it means it's only a spasm of the tube. If the dye did not spill out, then it means that tubes are actually blocked. Then the egg will not meet the sperm and you will not be able to get pregnant naturally. Am I making sense, Mary? Do you have any questions? So here she will tell you that, why don't you do just some surgery on my tube and open it? So here you will tell her that yes, there is an option of surgery to open tubes, But it is again going to be a technically difficult surgery because tube is a very thin structure, and this will again be done by an expert. Success rate is very low, it's about 30 to 50%. Even after surgery, we cannot guarantee whether tubes are working properly. Also, if you do get pregnant, there is risk of ectopic, that is pregnancy outside the womb, and it's a serious condition. Again, there is risk of surgery like bleeding, infection. There is risk of injury to the womb or neck of womb. There are other options also, like you can have IVF pregnancy, that is test tube baby, or you can have adoption. So would you like me to explain about these options in details? If she says yes, then describe and explain about the IVF. Tell her that in this medications will be given to stimulate your ovary to produce large number of eggs. Your egg will be collected and mixed with your partner's semen in a test tube in lab, and fertilized egg will be implanted in your womb. This will be done in a fertility center by fertility specialist. So there is again some risk, like ovaries will produce large number of eggs causing some tummy pain, that is the OHSS, ovarian hyperstimulation syndrome, or there is some risk of multiple pregnancy. And adoption is like you can choose to adopt a baby as a last resort. Am I clear so far, Mary? So if she says that she's ready for lap and die and she asks when can I have surgery, then tell her that okay, I will inform and discuss with my consultant, and this will depend upon the availability of dates. Okay, so I will also be giving you the written information leaflet about your condition and the management options. We'll arrange a follow-up appointment and give you the contact numbers for clinical access. Please feel free to contact us anytime, and also we'll give you the support group numbers. Is that okay, Mary? So do you have any questions? Thank you. So again, I have tried to make it very simple, and in a simulated patient task, we all know that we're not going to use any medical jargons. And if we use the medical jargons, then yes, we are going to explain that to the patient. Okay, so thank you so much. I hope this is helpful. Thank you.